Thank you so much for joining me here at the live desk. I am Janae Hancock. As we continue to talk about the latest updates that are coming in following the championship rally last week, literally 1 week ago from today, I think it's important that we check in with our mental health, not only here in our community, but also for our first responders because they are recovering as well. So with that being said, I do want to turn things over to our guest for today. You're taking a look at Dr. Stephanie Burris. She is the Chief Wellbeing Officer at Children's Mercy Hospital. And, Stephanie, you guys had a lot of patients come in last week. And I know we kind of talked about it before this interview, but you expected the day, like everyone else in the city, to be just exciting. And though you're prepared to take on patients that are injured and that are traumatized, you didn't expect for the day to end out the way that it did. So tell us a little bit more about what kind of toll this can take on everyone inside of Children's Mercy Hospital.
Yeah, Janae, it really has taken a toll, considering that, we're just blocks away from the site. And you are right. Everybody started the day in just a wonderful mood, and we're excited to celebrate right alongside our Super Bowl champions. And to end the day in violence was not anything that we ever anticipated going through. Our emergency management system kicked in, and they did such a wonderful job allocating resources to take care of the children that we knew were coming, and did just an amazing and outstanding job doing that. What we all expect is that the kiddos receive the best care possible, and they did by a long shot. Everybody showed up, did what they're trained to do, utilized their training to the best of their ability. What we are just coming to terms with here at Children's and across the country with our healthcare workforce is we're often referred to as, superheroes without capes. And while I would very much agree with it, I think what we all need to remember is that we are humans as well. And to end the day that started out so celebratory with violent acts and having to end up treating children that were harmed unnecessarily really took a toll on all of us. And so, what we're here to do in the Center for Wellbeing, and my job as our Chief Wellbeing Officer at Children's, is to really show up for our people and be here when they start to grieve. And we know that everybody grieves differently. So some were going through grief that day, some were later in the week, and we do know in the weeks to come that there will be more that will be dealing with this tragedy on their own terms.
You know, I love the fact that you touched on, you're known as capes with heroes, but you're humans as well. You have feelings. And that goes back to, though you may be prepared, and just like with mass shootings, students inside of their classrooms, they're prepared for situations like this, unfortunately, but you can never be prepared for when you see all of those wounded coming in to your doors. Now, talk a little bit about the programs that you all have hosted for your staff. I know you had a lot just within the last week since the situation. How have you really stepped up to be there for everyone that is really hurting and trying to take everything in right now?
Yeah, it really is coming to terms with the moral distress that we all have as healthcare providers, taking care of patients and children that are unnecessarily harmed, like I said. And so we really held what we called kind of office hours, where we created an open space for people to come and talk to any member on our team with a one-to-one in person or on virtual. We also have people that are off-site. And then we created a quiet space for people to come if they weren't at a time where they felt like they could talk about it openly, to just sit and reflect and have a moment of quiet to come to terms with what has happened. We did that for several days. We had a number of people come. We had a fantastic neurologist in our organization that does acupuncture for children with headaches that offered to provide calming acupuncture for a number of members for our team, and that was highly successful. We also are fortunate to have a staff therapy dog, Hunter, who is by far the most popular member of our team, who was here to provide staff support and went to the areas most impacted by this tragedy. And then we also have other facility dogs that were allocated to provide staff support that day as well. In addition, um, we had a hand in distributing some of the gifts that were given to us by our generous Kansas City community. So my team helped distribute meals to our employees that were impacted, as well as we had some floral donations to bring some cheer to our people, so helped support them in that way.
Yeah, I saw that you guys were giving away food donations as well as giving away flowers. And I think that that's sweet because it's kind of giving them their flowers and letting them know that they still matter and that you guys still care about them as well. What has the reaction been from your staff knowing that they have all of these resources available inside of their building?
It has been truly inspiring and gives me reason to continue this work and speak out for the necessity of taking care of the emotional trauma that comes with working in healthcare, and just the outpouring of support for what our team has done over the last week has been tremendous. And we're so thankful that we are given this opportunity as our team members.
And how do you all move forward from this point? Like I mentioned, we are 1 week from that event. It just happened 1 week ago today. How do you move forward with not only your staff now, but also the children that are going to be coming in just looking for some care as far as their mental health is concerned?
Yeah. Janae, thank you for that question. We are continuing, as I said before, we know that people will grieve and go through the different stages of grief after a traumatic event. And so, of course, we are readily available and have been this whole week. And we have continued with our on-site resources with our psychologists that work in our employee clinic, as well as some of our employee assistance programs that are on site through the week. And we are having a community provider and a physician town hall tomorrow to talk about just that, how we are going to respond to and what you need to look for all the children that are coming into our care as far as signs of trauma.
And it is important to note that all of the children that were under your care, they are expected to make a full recovery. Is that accurate still?
That is accurate. They all have been discharged as of late last week, and we're very thankful for everybody that responded and took great care of them.
Dr. Burris, I want to thank you so much for joining me here at the Live Desk for a very timely and important conversation. For more on our coverage following the championship rally at Union Station last week, we will continue during our newscast coming up at 4 p.m. until late this evening. Again, thank you, Dr. Burris.
Thanks, Janae.